Hello guys, welcome back to my channel. In today's video, I'll be talking about endometriosis and all you need to know. When I mean all, follow me from the beginning to the end of this video to learn all you should know about endometriosis. So, endometriosis is a condition where the tissue similar to the lining of the uterus grows outside the uterus. So, it's all about the tissue in the uterus, that is that tissue that sheds off during the menstrual cycle as your period, that is inside the uterus, now is found in the pelvic cavity, the ovaries and the fallopian tubes, and they respond to your menstrual cycle. They cause a lot of pain. So the causes are of endometriosis is retrograde menstruation. That is the menstruation that flows back into the pelvic cavity, forming those tissue. Then genetic factors. Some people have this endometriosis gene in their family. Then immune system disorder can also cause this tissue to grow abnormally outside the uterus, and hormonal imbalance. Them symptoms you experience to know whether you have this endometriosis. The first one is pain, pelvic pain during your menses, a lot of pain, painful menstruation. Then another one is menstrual irregularity. That is heavy period, you're bleeding in between your period, and your period is scanty, your period is heavy and all that. So this is one of the symptoms. And also infertility. Then, how do you diagnose this condition? How do I know if I have this condition called endometriosis? The first one you will do is pelvic examination or ultrasound. You get so ultrasound will be the one, or CT scan we will show whether you have this condition or not. And also laparoscopy, which means visual examination of the pelvic organs. Then treatment. Then how do I treat this condition? The first thing you should know about is pain relief. That is palliative care. You use of pain medication during your menstrual cycle to relieve pain and improve your quality of life. Then hormonal therapy, they give birth control pills and hormonal patches, which helps to reduce the growth of those tissue. Then another one is surgery, removal of those tissue that is formed. Then management. So what how can you manage it as an individual? How can you manage it by yourself? Is by heat, applying heat massage to alleviate your pain. Then another one is regular exercise, a healthy diet, and managing stress. A healthy diet with high anti-inflammatory properties can help shrink those tissues and relieve your pain. Another one is tips. What are the tips? I'm giving you the tips if you are trying to conceive with endometriosis. The first thing you can do is to consult a specialist, a endocrinologist or gynecologist, that will diagnose this condition and know whether you have this condition indeed. Then you track your ovulation. Ovulation tracking is very important for people trying to conceive. If you are trying to conceive and you are not tracking your period, you're on your own. Then another one is healthy lifestyle. Maintain a healthy lifestyle. Eat balanced diet, food with high anti-inflammatory properties like turmeric, you get. So another one is consider medications. That is that hormonal pills that your doctor will give to you, and other hormonal balancing pills that your doctor will give to you to regulate your menstrual cycle and improve your fertility. Then support therapies like acupuncture, massage that can help to alleviate your pain. Surgery will remove those endometrial tissues that forms outside the uterus to improve your fertility outcome. Then support system, you need love, you need care, especially during your menstrual cycle, and emotional support by your family and friends. Patience and positivity, understand that it might take time, but you can still conceive. There is nothing that will stop you from conceiving. Then natural remedy for endometriosis. What are the natural remedies? The natural things that I can take to help me improve my symptoms and alleviate the symptoms I have with endometriosis. The first one is diet. I've spoken about is high anti-inflammatory foods and herbal supplements that contain turmeric, cinnamon, and ginger. You can make the tea by yourself. This can help to remove those tissue to an extent. Then heat therapy, applying heat pad to alleviate your pain and discomfort during the menstrual cycle, pelvic massage, and acupuncture. So these things helps to manage your pain, you get. But these supplements that I mentioned and diet helps to cure it. It helps a lot. It goes a long way to cure endometriosis. So another thing I'll add to add is exercise and stress. Stress has a lot of as in a lot of things that it does to our health, like increasing your cortisol level, which can scatter your hormones, you get. So if you stop as in stress, you minimize stress at a level, you see that most of the symptoms you experience will reduce, and taking of omega-3 fatty acid. Thank you for watching today's video. I hope you learned something. If you like this video, give me a thumbs up, share my videos, and comment on the comment section for more health tips. Thank you.